The whimsically named monkeypox is anything but fun. The zoonotic virus is similar to the now eradicated smallpox, presenting with fever, headache, muscle aches, exhaustion. Oh, and of course, the namesake lesions that give the disease its name. For more on what you need to know about the latest virus to hit Montreal, it's the one and only Dr. Donald Vinh, infectious disease specialist, clinician-scientist at the MUHC. Dr. Vinh, welcome back.
Thanks for having me, Elias.
Now, is it exciting to not talk about COVID?
Yeah, but to be honest with you, we often talk about things other than COVID in our business.
Very, very true. Very true. So, announcement yesterday, 2 confirmed cases of monkeypox in the province, 20 other suspected cases still under investigation. Are you concerned?
Well, I have to say, we have to separate here the levels of concern. There's a level of concern of the medical and scientific community, and then there's a level of concern that the public needs to have. So as a physician and as a scientist, as a microbiologist who's on call this week and having to try to figure out how we're going to make these diagnoses, yes, I'm concerned. It's a virus that's extremely rare, that hasn't shown its face in North America for 20 years, and when it did, it was in the U.S. So it's brand new to Canada. So yes, there are some concerns on that end. There's some concerns about not only how do we accurately diagnose it, do we have protocols in place to isolate and manage patients, and all the potential other clinical issues that go along with that. But as a public person, am I worried about it? No, I don't think we have enough data at this moment that tells us that the public needs to be worried about it. What we need to do is acquire data and find out how many actual confirmed cases do we have, how do we get these under control, how do we control them, how do we make sure that their contacts are not infected, and then once we get a better idea of the magnitude of the issue, then we can talk about whether the public really needs to be concerned or not.
Well, let's talk about the symptoms here and what monkeypox causes. What can you tell us?
So first of all, monkeypox is a virus, and for people who say, "Well, I'm not exposed to monkeys, I don't have to worry about it," that's actually not the reservoir. The reservoir are rodents, particularly because it's from Central Africa. It's rats and rodents in Africa. What's unusual about the cases that we're talking about now is that there seems to be no obvious link to either visits to Africa or infected animals. And so what happens when you get infected is that you have sort of 2 phases, right? The first phase is when you actually have what we call systemic symptoms. You have flu-like symptoms. You have fever, you have sore throat and cough. And that's going to be a problem because, we also have COVID and flu that can do the same thing. And then about a week later, you start developing all these skin lesions. Like you said, the pox, which looks at the beginning a bit flat, then it becomes these bumps. The bumps become filled with fluid. That's what we see as pox. And then, of course, they can then rupture. And so those are the major symptoms. And the thing about monkeypox is you also get swollen lymph nodes, which, that's one of the distinguishing features. So once you get to that, you realize this isn't going to be COVID.
And what are the treatments here, Dr. Vinh? Like, how do you treat someone who comes in presenting with these lesions?
Well, the usual course for monkeypox is that it lasts about 2 to 4 weeks, which is actually quite a long period of time. And unfortunately, because most of the cases of monkeypox in the world have been in Africa over the last 50 years, which unfortunately, because of our global inequity, is also the places where there's the least amount of research dollars available, we don't actually have much information on how to best diagnose monkeypox and, more importantly, how to best manage it. There are no medications right now that we can use that can actually effectively treat monkeypox. So what we do is supportive care. Because of all the pox lesions, we have to have that patient isolated. We have to give them any fluids if they get dehydrated, all that kind of stuff. What we can do is, if we see that the magnitude of the problem becomes large and that it may become a problem for the community, then obviously we have to talk about public health measures like masking and isolation, but we also have to talk about vaccination. Because even though there isn't a vaccine for monkeypox, the previous vaccine for smallpox that we used to eradicate smallpox seems to show a very, very good, in fact, excellent protection against monkeypox, somewhere on the order of about 85% or more. So that may be something that we have to consider if the situation calls for it.
And the monkeypox is spread. It's spread by close contact. I've heard some talk that it's almost the kind of close contact that comes with sexual relations here. What can you tell us about the transmission?
Well, monkeypox in general has actually two major modes of transmission. One is by direct contact. So you need to have touched basically the bobos or the pox of an infected animal or infected person. That's one way. That's a direct contact. The other way is by respiratory route. And we know very well from COVID that the major respiratory routes for COVID are droplets and aerosols. Well, it actually turns out that, monkeypox can also transmit through the same way, droplets and aerosols. Perhaps not to the same efficiency as COVID, but those are the two ways, direct contact and respiratory. What we're seeing with these clusters of cases is that they may be related to a type of common activity among all the people that are being under investigation right now. And in those activities, it really involved more direct or intimate contact, and that explains why some of them also have all the lesions in their private areas. But again, that is just sort of one manifestation that we're seeing.
Okay, Dr. Vinh, I guess on the respiratory side of things, another reason to wear a mask.
Yeah, another reason. I mean, I have to say, you don't have to necessarily be worried that you're going to get monkeypox when you're going to go buy your groceries, right? It's not just that you're walking by somebody and, oh my God, I'm going to get monkeypox. Right now, it seems to be very limited to a discrete group of people who participate in an activity. Yes, they may have spread to others, and so that's what the public health and contact tracing will need to figure out. But I don't think that the public needs to be worried about that. But yes, it goes back to your point. A mask will protect from more than just COVID.
All right, Dr. Vinh, thank you so much for taking the time with us this morning. Always great to talk to you.
Thank you, Elias.
That is Dr. Donald Vinh, infectious disease specialist from the MUHC.